A man might not ask for help for depression because they firstly mightn't recognise they're depressed, and that's very common, and they think it's something to do with them, something to do with them not working hard enough at work or being effective enough, some failing that they've made in some level, or perhaps even some personality flaw. So they don't really see it as a thing that requires treatment or as something that's going to get better with treatment. So that might be the first thing. Men might not even recognise that you can get treatment for depression, despite all the publicity and things about it. They might be busy doing other things and not even hear any of these messages that we're trying to put across about how effective treatment can be. The other thing is the stigma around mental illnesses is probably more felt amongst men than it is amongst women. Men don't like to feel stigmatised, so therefore might want to deny the fact that they're depressed as a way of avoiding that sense of feeling like they've failed in some way. I think the stigma that men put on themselves is probably worse than the stigma that other people put on them. We treat depression all the time. It's a very common condition to treat. We treat it by looking at, firstly, making sure that it's depression that you've got. It's not due to a medical illness. Some medical illnesses like anemia or low thyroid, or even some medications, alcohol, can all lead to depression. We then look at the factors that might be making you depressed that you can change, and sorting those out. And then tailoring specifically a talking therapy that will, if it's necessary for you, and if you've got a depression that's moderate to the more severe end of the spectrum, then medication is probably going to be necessary and helpful for you as well. There's a good response to treatment for depression. Like any condition, the majority of people do get better with treatment, and with good effective treatment. It's easier to get better with treatment if you get in early, and if it's not let go grumbling on for a long time. Usually people can get some symptomatic relief quite early after treatment starts, and then it can be 2 to 3 months before you feel really nearly back to your usual self.